This month, our topic of conversation is sleep health and its connection to kidney care. Sleep occupies nearly a third of our lives and is a critical function during which your body balances and regulates its vital systems, including growth, circulation, and your immune response. We've all heard that saying, you'll feel better after a good night's sleep. Does it hold meaning for our physical health? And if so, how and why? Are important, how important is sleep when you have kidney disease? What are the common sleep disorders associated with kidney disease? And are you getting enough sleep? These are just a few of the questions we'll cover in our discussion today. But before we do, we have a little housekeeping. We have a little bit of housekeeping. We want to hear from you. So please use the chat box to send us your questions. And we also have a survey at the end of the webinar, but then we're also going to have a cool poll during. So please, if you have the chance, we'd appreciate it if you could take a look at that. I'm really excited to announce our guest today. Today we have Charmaine Griffith. She's a ReMend mentor and patient advocate. Charmaine is a 2-time transplant recipient who has experienced in-center dialysis and peritoneal dialysis. Cindy Polis is the care manager and education nurse at Balboa United. She works with chronic kidney disease patients to help optimize a healthier lifestyle and educate patients on different modality options for dialysis. We're very happy to welcome Dr. Daniel Cukor. He's a director of behavioral health at the Rogosin Institute, a kidney treatment and research institute in New York City. The bulk of his research has focused on psychosocial issues in patients with chronic kidney disease. He's done novel work developing and testing treatments for depression, insomnia, pain adherence and anxiety for people with renal failure. He lectures nationally and internationally on psychosocial issues for patients with CKD and has written extensively in the scientific literature, with his work cited over 3,500 times. He is also the lead editor of the recent volume, Psychosocial Issues and Chronic Kidney Disease. And I'd also like to welcome Michael Kenyon Rosenberg. He's also a ReMend mentor, comedian, public speaker, musician, and kidney transplant recipient. So I'm going to stop sharing here and introduce you to all these folks. Everybody but me.
And Kiku.
And that's me. Thank you so much for being here, everyone.
Thanks for having me back.
I was hoping that we could just kind of go around the room and, let's, like with Cindy. Cindy, I wanted to talk a little bit more about what you do with Balboa United in your position.
Sure. So welcome. Thank you for attending, all of those attendees that we have. And of course, our panelists, thank you. So I think this is super beneficial. Any good news, any education, information, especially coming from our guest speaker today, to help those who are struggling and suffering and want to learn more about sleep and sleep disorder related to CKD, because I'm an educator. I'm all about education. So that's what I do for Balboa Nephrology. I really try to seek out and support my patients on modality education, and also not just on the modality, but I really try to support in the journey. So there's a lot of different expectations and unknowns coming into CKD, ESRD. So that's where I really like to try to be present for my patients. So that's what I do.
Thanks,
Thank
Cindy.
you.
And how about Michael? Tell us a little bit about your kidney journey.
My kidney journey started way back in 2012 when I was diagnosed. So let me go further back. I was born in so it was back
that far
2012 when I was diagnosed with CKD, and I held on for a while. I didn't start dialysis till 2015. And I've only done peritoneal dialysis. I've talked to people, I've been in a center where hemodialysis was done. Very scary for me. Some people like it. I don't know why. But I ended up getting a transplant November 2021. So I'm coming up on my 1-year
Yay.
anniversary. Oh, thank you, Cindy.
Congratulations, congratulations.
And so I moved down here to San Diego, and I saw a poster for ReMend on my nephrologist wall, and I said, I have to call whoever that person is. That person turned out to be Kiku, and the rest is history.
Awesome.
Nice.
Thank you so much, Michael. Thanks for being
Perfect.
here. And Dr. Cukor, wanted to talk to you a little bit. Tell us a little bit, like why did you decide to work with or learn more or research CKD patients? What was your interest in nephrology? How did that begin?
Well, thank you. So I'm a clinical health psychologist by training, which means I went to school to really understand the relationship between psychology and medicine and how patients, kind of the mental health side of illness. So that's really been my interest. And when I started my career, I was kind of pretty open-minded about working with all different illness groups and illness populations. And then kind of through serendipity, I was called to a consult in the dialysis center. And honestly, I did not know what dialysis was. And I went in, and I guess not dissimilar to other people's experience, the dialysis center is neither like an inpatient, it's not covered by inpatient psychiatry typically, and to outpatient psychiatrists and psychologists don't typically make house calls, so you have to go to them. So the dialysis, I think a dialysis nurse called me and said, look, we have a patient who's really struggling, but they can't make the appointment. Would you be willing to walk 2 blocks and come and see them? So I said, okay, 2 blocks isn't too bad.
Get some exercise in, yeah.
Yeah. So when I went over, I was kind of just, I guess, overwhelmed by the amount of need that I saw in, the patient population, but also like the amount of, I guess, like the desire on the patient's behalf to really kind of engage and to benefit from the things that I had to offer. I felt like many other medical populations, maybe people are over-serviced and the patients are not sure that they really want to engage, they're kind of hesitant. But at the dialysis center, I found if you were offering an ear to listen to someone or suggestions, people were very enthusiastic about kind of having that conversation, really listening. And I became interested and, started to listen more and read more about kind of the relatively small literature on dialysis and mental health. And quickly it became, the focus of my career.
Wow. And we're grateful for that, because I know you have a lot of wonderful information that we're getting ready to hear and learn. So thank you. And thank you again for being here.
Sure.
Miss Charmaine, can you tell us a little bit about, why you're a part of ReMend?
So that's tough to follow. So I appreciate you putting me last. Well, when I started with ReMend, I had been transplanted for some time, over, I think it was about 11 years. I had just made my 11th year anniversary. And, it just got to a point where I just felt I needed to be more involved in helping. And in the beginning, I just felt that I was just so elated, and I did traveling and all this kind of stuff. So when all that kind of subsided, I found out about ReMend from the social worker at the clinic where I dialyzed. Mm-hmm. And so, I sent an email off and made a call, and just, really fell in love with the organization and what it was doing, because it just wasn't around. Mm-hmm. When I was dialyzing, and it would have been something that would have been very beneficial for me to be able to speak to somebody else. So there may have been other programs, but I just wasn't aware of them. So right. I just felt it was a really great opportunity to give back. So I'm really excited about today, because definitely experienced a lot of sleep problems during dialysis. So very, 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 very excited about awesome. Today's program.
Well, thank you so much for once again being here. So I'm just going to throw a softball out there. How important is sleep when you have kidney disease? My question is directed to Dr. Cukor and Cindy, obviously. So, Dr. Cukor.
how important it is, it is very important, probably more important than if you don't have kidney disease, and that, your body's already under additional strain and you need to kind of rejuvenate and heal as best you can overnight. The problem, for most folks is that sleep is harder to come by. And, I guess we'll get into this over the course of the evening. There's a lot of different reasons why sleep is harder to come by, but I think the bottom line is that, a good night's sleep, a nourishing night's sleep is essential for everybody. And, the more kind of health difficulties you have, the more not good you're feeling, the more essential it becomes to get a good night's sleep. But paradoxically, sometimes it's, just more difficult to get it. So hopefully some of the things that we talk about today will be helpful for people to be able to kind of get into a better cycle and to get into a better pattern where they'll be able to have a good night's sleep.
Nice. There's something I want to do a little different today. I was online looking up sleep facts, and I wanted to get your input, Dr. Cukor and Cindy, on some of these sleep facts. Just maybe these are some of the things that people are also seeing online, and just want to get your thoughts on this. So let's check this out. So sleep disorders are common in people with chronic kidney disease and end-stage renal disease, and many often have trouble falling asleep and staying asleep. We kind of just talked about that, right?
Yep.
We can vouch for that, everyone.
Yes, exactly.
But I think we have a question. I'm so excited when you have questions. Untreated sleep apnea can make the symptoms of chronic kidney disease worse. Can you, Dr. Cukor and Cindy, can you guys talk about what is sleep apnea? Where'd Cindy go? Is she here?
She's
I
here.
went first.
There
I
she
went
is.
first last time. Cindy, do you
I'm
Cindy's
gonna
in the
let
hot
the
seat.
specialist take that one first.
All
You don't
right.
wanna-
So sleep apnea is actually not a sleep disorder. It's really a cardiovascular disorder that presents at night. And what it is, there's a weakening of the lining of the wall of your throat. So when you sleep, there's actual moments of apnea or gasping for air. And it can cause additional strain on the heart. So it is, let's say a night or two of insomnia, of just difficulty falling asleep, is probably not a medical issue. Sleep apnea really is a medical issue. And if you think you might have sleep apnea, it is certainly something that you have to aggressively pursue, which for people with any chronic illness, it's hard to have another problem that you need to aggressively pursue. But sleep apnea, I think, is one of them that I really encourage everyone to aggressively pursue. And then if you are diagnosed with sleep apnea, to follow through on all of the recommendations, which often involve CPAP, which is this continuous positive air pressure machine that essentially, blows air down your face so that keeps your airway inflated, so you don't have these moments of apnea, so that you get kind of a healthy amount of oxygenation throughout the night. People sometimes complain that it is unpleasant to sleep with the CPAP machine, and I believe them, but I think again, if you need to, you need to. And I think patients that have been in peritoneal dialysis, they understand. I think that's certainly a skill set that they have developed, is sleeping through adversity. So this is just another challenge that they need to work through.
My husband has a CPAP, and not only is it wonderful for him, he feels so much better after, wearing that the next morning. He really did get a good night's sleep. But for me, because he snored so much, which didn't really help my insomnia. But so CPAP is the way to go.
Do you get some white noise with that too, or something? Because white noise super helps me get to sleep now.
Oh, yeah. I didn't think about that. I used
maybe it's because like I slept with a cycler for so long. I was on PD for 6 years, and so I slept with a cycler going all night. And then that's the noise it made. That's just not me gargling. That's the noise that the PD machine made. And so like I slept with that for 6 years, and then now I'm just like, I needed a noise machine to get to sleep.
Yeah, it makes sense. Okay,
I think your experience is not unique in that a lot of times people themselves don't realize that they snore very loudly or that they gasp for air. It's often their bedmates, or sometimes it's even their housemates or their neighbors that can hear them kind of gasping for air or snoring that loudly.
Yeah.
There are actually apps for your phone that are free that essentially turn on a microphone randomly in the middle of the night, and then it can analyze kind of the sound of your snoring and tell you whether you should perhaps talk to your doctor about getting a more formal diagnostic exam.
I heard about that just last night, that there are apps like that. So, all right, I'm gonna check it out.
There's an
so I
app for
never need
that.
Yeah. How about this one? People with chronic kidney disease, CKD, often have trouble falling asleep and staying asleep.
Mm.
I know that was an issue for me when I was diagnosed. Staying asleep was my issue. How about you, Charmaine? Is she here? Oh,
She's here.
you're muted.
She's muted. The classic Zoom
Muted.
blunder.
So when I, when I was dialyzing, I always had problems falling asleep. I had really bad insomnia. So I think once I got to sleep, I felt a lot better. I mean, I was able to sleep, but it was just a matter of getting to sleep. But the insomnia and the restless leg, the combination of the two, it was just, it was horrible. Absolutely.
I want to
horrible.
get into the restless leg thing. That's a big issue that a lot of people don't realize other people are experiencing that. So I wanted to ask you, Dr. Cukor, I'm going to stop sharing this here. You're big into the insomnia studies. You just did a study recently. I'm wondering if you could share a little bit about the information you learned in your research.
Sure. Well, unfortunately, I can't share much about what I've learned, but I can tell you about what we've done.
Okay.
The reason why I can't tell you what we've learned is because we have not yet learned what it is that we're going to learn from this study. But for the past almost 4.5 years now, myself and colleagues at the University of Washington and at the University of New Mexico, we've been studying insomnia in patients who are on in-center hemodialysis. And what we did was it's a 3-arm study. So people got randomized 1:1:1, which means equal amounts of people into the 3 groups. And one group is trazodone, which is a really commonly prescribed medication for people that can't sleep. Another group got a placebo, which was designed to look just like trazodone, and we will see if there's a difference there. And then the third group got a behavioral treatment called cognitive behavioral therapy for insomnia. And the treatments were for 6 weeks. And then we evaluated people again at the end of 6 weeks to see how they were sleeping. And then we followed up again with them at 24 weeks to see how they were sleeping. And we are kind of anxiously awaiting to see what the results are. And what we anticipate is that at the 6-week point, probably both the trazodone and the CBTI, the behavioral treatment, will work better than the placebo. We think doing something for for the insomnia, either one of those will be effective treatments. And probably at 6 weeks, we won't be able to see a difference between the two of them. We don't know yet. But then we think at 24 weeks, what we think will happen is that the people that learn the skills of how to kind of change their sleep cycles, we expect those benefits to stay for the months after. And the people that were on a medication and then stopped the medication probably won't see the benefits of it continuing on for months and months afterward. So we're predicting that the people that are in the behavioral group will probably do better than the other 2 groups by the time the 24-week evaluation comes along.
Wow,
That's how you do
interesting.
science right there. I love it.
I was actually going to ask a question about cognitive behavior therapy and how it helps treat insomnia, and if a combination of the two, including medication, is something that is recommended or that people do. I mean, I'm sure people do all kinds of things we don't know about, but
Yeah, some people don't do CBT, they do CBD, and we're
that's
not going
another
to
one of
talk
my
about that.
questions. That's another one of my questions. So I'm glad you brought that up, Dr. Cukor, about CBT.
Yeah, so combination treatment is, it's in clinical practice. If you're desperate, you do whatever you can to feel better. in
Mm.
research studies, they really like it to be a little more pure so that we can really understand kind of what is happening, as a direct cause of what. And
Mhm.
while insomnia is really prevalent, it is actually very challenging and very expensive to do studies at a dialysis center. So one
Mm.
of the kind of hallmark challenges is always just, how many people can a study afford to enroll in its, in the time frame that it's supposed to have. So usually we kind of just, have to distill it down to the most essential, most important questions, because we don't really have the luxury of kind of getting to some of those important but secondary questions.
Gotcha. How, we're kind of talking about this. How do things like melatonin or Ambien, how does that impact the kidneys? And Cindy, you can jump in on this one too. I mean, is that something that, a lot of, I know I was taking melatonin and it helped for me a little bit, but what are your thoughts on that when kidney patients are taking melatonin and Ambien and Restoril, things like that?
Trazodone. They gave me trazodone when I got my transplant once to help me get to sleep, knocked me right out.
Mhm.
But then they said, "Oh, we don't want to keep you on that long term." So my nephrologist did mention melatonin. So I'm interested to hear about how that
Yeah,
affects.
is it hard on the kidneys? Cindy?
That I mean, from coming from me, I really don't know. I think maybe because it's a natural supplement.
Mm,
But even still, I would always check with your nephrologist before you
Yeah.
start
Mm.
anything, even
Yeah.
natural supplements. And every
Yeah.
person is different because everybody's on a different regimen and treatment plan. Some are taking cardiac medication, you know what I'm saying? So we
Right.
don't have any contraindication for any of it.
Right. Dr.
Yeah, I
Susan?
was on Ambien for
Oh.
just, they would put me on Ambien and then take me off because it would work for a very short time. And then, so I'd go off of it for a while and then they try it again. But yeah, nothing that would work consistently, probably for the same reason.
Yeah. And I would try to focus more on maybe trying to treat the cause, not treat the symptom, right?
Mhm. Mhm.
Mm.
Kind of what you were talking about, the behavior therapy. And I mean, if
Right.
that's possible, I know sometimes you just can't and you need medication,
Mhm.
but I think some of it can be managed.
Mhm.
I think we don't really know the impact of melatonin. I would say in general, whether it's efficacious or not, whether it works for people or it doesn't, how much you need to take, how often you need to take it. We don't really have, I don't think, those answers in general, and specifically for people with kidney disease. I don't think we have, safety data. I don't think we really know. So like Cindy said, you got to talk to your physician and get, advice that's kind of tailored for you. But I don't think there's a standard recommendation out there. And in terms of whether there's increased risk for patients with kidney disease, there is a study that did show that there was increased risk for falls and deaths for people taking the type, the Z drug, zolpidem, and also benzodiazepines. It is unclear whether that is kind of unique to their kidney disease status or perhaps maybe more related to age or other illnesses that they might have. It's just kind of one of these studies that looked at just large amounts of data and found a relationship. It wasn't a prospective study, so we don't really know that it's how directly related. But for me, that was an important study that really showed that we need to do better for our patients, that this is probably not a great solution for a great number of people. It's certainly helpful in the short term, but do we want people to be on these drugs indefinitely? Certainly
Right.
not.
Right.
And we do know that they cause lots of kind of anomalous or strange things to happen. People have weird dreams. People are kind of half awake, half asleep. So it's kind of an unpleasant way to be, and you can also have grogginess after. So it's not really kind of getting you the type of sleep or the kind of regularity of sleep that is kind of the most restorative or the most healthful. So if we can get people to get to sleep in ways that don't involve some of these drugs, I think, in my opinion, those are preferred.
Speaking of, how much is enough sleep? I mean, we hear, 8 hours, 7 hours, if you're not getting at least 7 hours. I mean, I guess obviously this is a topic for anyone with CKD and ESRD or anyone, right? So are we getting enough sleep if we're getting 7 hours? Like, what do you think a kidney patient or a CKD patient or dialysis patient, is there a difference in the amount of sleep someone needs when they have been diagnosed?
I don't
A
think
lot.
I don't think we really know the answer to that question. What we know is that as we get older, we do require less sleep. So, there's a lot of, a kidney disease patient is not, that's just one fact about a person. There's other facts about that person that probably also play into how much sleep they need. But I think at some level, there's a lot of individual variability as to how much sleep people need. And what time people wake up, we can see it from the time that, our children are born. There are some that sleep easily. There are some that are difficult sleepers, and that actually tends to be a characteristic that is lifelong. And so, as people are individuals, they need to know what their kind of ideal amount of sleep is. And I think the challenge is when you know that you need a certain amount of sleep, for the last 40 years of your life, you've been sleeping this amount, and then because of stress or because of, let's say, some other element of the disease, you're not able to get that amount of sleep. So then there's like this additive effect of each night you're kind of losing sleep instead of gaining into that sleep deficit. It just becomes more and more difficult, and that is when there's an effect on the body. So whether it kind of starts that way or ends that way, there's certainly a relationship between poor health and poor sleep. So I don't think that there's an exact number that you can tell everybody you need 7 hours, you need 8 hours. I think what we need to help people is to get them to sleep the amount that their body tells them that they need to sleep.
I like
Yeah,
how you
it's so-
said that we need less sleep when we get older, because that makes me think, okay, when I was getting like 12 hours of sleep when I was a teenager, that was fine.
Yeah, I really like that you said that. It really depends on each person and what our body is requiring of us. And just to kind of piggyback on that, I've heard a couple of things where, try to do the same thing, like go to sleep at the same time, don't eat certain foods, like just try to get a consistent routine with what you do, keep your room cooler and, make it darker and all that kind of stuff. And I find that even though I absolutely despise sleeping, going to bed when it's cold, but I find that I sleep better when it's colder in my room. So yeah, it's just kind of like, how do you balance that out? Like stepping on that cold floor and jumping into cold sheets, but then getting a really good night's sleep. I don't know.
Right.
I just burrito myself into my blanket, much to my wife's chagrin.
Yeah, that's right. Yeah.
Well, we're going to talk
Yeah,
about some tips later, and I also want to know what you guys do as far as what helps you get a good night's sleep. But one of the things I also wanted to ask is, if you are getting a good night's sleep, if you are getting enough sleep for your body, does it? I think I already know the answer to this, but how does it help boost your immune system? Does it help it boost your immune system? So you wake feeling refreshed, right? Is that kind of a sign of boosting your immune system, Dr. Cukor?
I mean, certainly that is the belief, right? That if you have sleep deficit, your body is working harder, and then there's immune compromise, right? It's just working harder, and you're not optimized from your immune system's perspective, and probably from a host of different perspectives. Sleep is really something that is restorative for all systems in the body. So if you are not sleeping well, probably nothing is really working optimally. And that makes us particularly vulnerable to injury, disease, all the things that our body is constantly fending off. Yeah. So when we're sleeping well, we are, as close to optimized as we can. And for those of us that are immunocompromised, we don't need more challenge in our lives. We want our body to be working as, efficiently as it can be. So getting a good night's sleep, feeling restored and energized in the morning is really important.
I also read there that somebody that's getting 4 and 5 hours of sleep, it's kind of the same effect as driving while intoxicated or because you don't have all of your, like, you don't have the, your reflexes are slower and things like that. Your response time is slower. Yeah.
Hmm.
Even though we feel like after one cup of coffee, we're good to go. Ooh, probably really not.
Right. As far as insomnia goes, how do you, there are people that have had insomnia for years, right? Like how is that affecting their overall health? I mean, we've kind of touched on, you need a good night's sleep, but do you talk to people, Dr. Cukor and Cindy, that I've had, for me, I've had insomnia for many years. So what can someone do about that? And what's your experience with dealing with people that have that situation?
I guess I'll go first on this one. So,
Sorry.
insomnia is really common in the kind of general population outside of the kidney disease world.
Mm.
It is really common, and it's even more common within people that have kidney disease. So, there are some people that have kind of been sleeping well, and then they have what medical difficulty, and then their sleep is suffers as a result of it. And there's other people that have been sleeping poorly kind of premorbidly even before they got sick, and now this is like insult to injury. Now they're really have a challenge around their sleep. And we take all comers, so all kinds of sleep difficulties are welcome. And I think that regardless of what the kind of etiology is of why you have sleep difficulty. So a lot of times people are really focused on, why am I like this? What's the physiological mechanism? And the nice thing about CBTI, I guess, and drug too, is that it's kind of ideologically blind. It doesn't really matter how you get there. What matters is kind of, where do we go from here and what do we do it? So, I always tell people, your body has lots of very good reasons to not be able to sleep well. And I will grant you all of those. But given that, we still want to do the best that we can. So
Right.
let's try to optimize the circumstance that we have. And there's certain things that are within our control. And, yes, if you need to be on hemodialysis, it does impact people's ability to sleep. That's true, but if you need to be on hemodialysis, then you need to be on dialysis. And
Right.
if you're on PD and you can't sleep at night because the machine is whirling or alarming every few moments, that is a challenge that you got to work through. But it's a
Right.
challenge you got to work through. We have to kind of deal with that reality and then try to
Right.
build the best possibility for sleep that we can around that. And
Right.
there are different strategies that we recommend to people, and it's called cognitive behavioral therapy for insomnia because it has kind of different components to it, both cognitive, referring to the thoughts that we think, and behavioral, the things that we do. And a lot of people have really dysfunctional beliefs, really unhelpful thoughts about their sleep, and they have assumptions about themselves, how much sleep they need, how much sleep they don't need, how all ends of the spectrum, how well I can function great on 4 hours of sleep, or if I don't get less, if I don't get 7 hours of sleep consecutively, I'm worthless the next day.
Right.
Right. So those kinds of beliefs, while maybe based in some reality, are really kind of unhelpful for us if we're in a situation where we can't sleep 7 hours consecutively. So we really have to kind of be very, very mindful of the types of thoughts that we are having and the little messages that we're giving ourselves around our sleep. And there's so many myths out there about, how sleep works, that sometimes with a little bit of information and a little bit of just kind of, reframing, people can kind of get into a much better positive space about it.
Have you ever heard of the Whoop Watch, WHOOP? And you can pay a membership.
Whoop, whoop.
Yeah, a Whoop Watch for $300, and then it can track your sleep, like what sleep you're in, how many hours, were you in your REM sleep, this and that. Honestly, my husband did that, I think, for almost a year, and I think it made it worse. Because then
Oh, wow.
he was like finding out that he didn't get enough sleep and that he wasn't in his right sleep for the right amount of time.
Stressing out.
And it made him more anxious knowing and tracking it than not.
Right.
Yeah.
Right. Right.
you know, when you know and you can see it and you can visualize it, supposedly it was doing the right thing. Who knows?
Right. I guess you
think
just have to
that's
train. Oh, go ahead.
Yeah.
It's two excellent points. I would say one is who knows if it's doing the right thing. So,
Right.
you know, the gold standard are, you know, to really tell if someone is, you know, how someone is sleeping, they have these overnight sleep labs where you go and they hook you up to, you know, a full EEG and a full EKG, and they kind of, you know, do this whole sleep assessment. And it's expensive and it's difficult for patients to do, and it provides, you know, a wealth of information that we consider to be very accurate. And now there are a million, you know, one-off technologies that say we approximate that, and it is unclear to what degree they really approximate that quality of information. And then second of all, even if the information was perfect, you know, what is the value of that information, I think is an
Yeah.
excellent
Right.
question. So for our study in particular, so insomnia is a patient-centered diagnosis, which means that the way that you know someone has insomnia is that they tell you that they're not sleeping well and that they don't feel well. There's no objective lab test that you need to do. There's no blood test that needs to happen. However, you know, our kind of scientific universe is very focused on objective and biometric measurements. So they said, you got to find a way to have an objective measure of sleep in your study. And we kind of went back and forth about how we wanted to do it. You know, they had suggested overnight sleep studies, and we said, who is going to go and tell a dialysis patient that in addition to going to dialysis 3 times a week, now we're going to ask them to spend 1 night a week in a sleep center? We're like, I don't even want to ask people. I don't think they're going to do it, but I don't even want to ask them to do it. So we kind of dropped that. And what we're using is actigraphy, which is like, you know, kind of like what you're describing. What we're using is like a medically sanctioned device. It's FDA approved. It's a wristwatch that you wear that measures movement and respiration rate. And it is supposed to be able to tell you when you are asleep and when you are not asleep. However, if you don't move a lot, if you don't move your arm a lot and your breathing rate is kind of slow, it can't tell the difference. So we have people that are, while they're at dialysis, it's not able to properly distinguish when they're asleep or when they're not asleep. We have patients that don't like wearing it while they're being dialyzed, even though it's on their non-dialysis arm, so they take it off, which they're not supposed to do. You know, there's a lot of challenge, I think, in real world and kind of measuring sleep. And then I am not convinced that the data that we're going to get from these watches is more accurate than asking people, you know, how many hours did you sleep last night, or completing a more rigorous sleep diary.
You know, Fitbit does it too. And Cindy,
Yeah.
I was a little anxious about that too. Like, oh, I'm not getting enough, you know, so I totally understand what you're saying. And that totally makes sense. Everything you're saying, Dr. Cukor. I mean, how do we know that what it's really, you know, is it useful for you? But I do want to say we have quite a few questions, which I'm very
Yes,
excited.
that's fun.
So this one came in a little earlier. Arlene, I didn't mean to go over, didn't miss what you said. We were talking about sleep apnea, and she says, you stop breathing in your sleep. Is that basically what we were talking about, Dr. Cukor?
I'm sorry, say that one more time.
With sleep apnea, you basically stop breathing when you're asleep, is what Arlene was mentioning, right?
Yeah, that is the apnea, is the kind of the gasping for air. You just don't get enough airflow.
That is scary when you hear your partner, you know, doing that, or you do it, it's freaky, but hearing someone do it is not pleasant. Janice, thank you for your question. Is there a resource that you can share for the behavior changes?
I don't
I think
have
she's talking about the CBTI.
Yeah, I don't have a link for it, but I would say, you know, there are lots of resources out there for CBTI, and I think they're all they're very similar. They're kind of all excellent. I like to watch things instead of read things. So if you go to YouTube and you kind of, you know, type in CBTI, you can watch it in just a few short videos. They'll kind of explain it to you, and then there's a lot of exercises that you can do along. But I can probably share that maybe after we're done, and you can forward that along if
Great.
you'd like to send it out. Yeah,
I would love that. And let's see. Arlene has a question here. Does too much sleep affect your, too much sleep can affect you for
you, yeah.
Yeah, but affect you, for example, 9 to 10 hours. So if you oversleep, I mean, I always wake up, if I'm sleeping too much, I'm super groggy. I mean,
Yeah, me too. Same.
what are your
I mean,
thoughts?
there's data that's not, as far as I know, not in the CKD population, but there's data in the general population that undersleeping or oversleeping are both associated with negative health outcomes. Whether that is because you're sleeping too much, or perhaps it's because sick people tend to sleep more, and therefore the people that are sleeping 9 to 10 hours are people that have other chronic conditions. I'm not sure. But I think generally speaking, from a heart health perspective, they recommend like 7 to 8 hours, not really much less and not really much more.
Mhm. Thanks, Arlene. And Patrick, I think this is Patrick from the pharmacy
It
that we
is.
know. Hey, Patrick, thanks
It
for being
is. Hey,
here.
Patrick.
I'm a PharmD, CKD, and ESRD coach for patients, and strongly believe in coaching patients to find generative hobbies, which I think will help patients cope and become resilient with anxiety, insomnia, and depression. Thanks, Patrick.
Great. Yeah, that's
Um,
great tip.
And then, they're having a conversation here. So Matt asks, what are generative hobbies? And then Patrick says hobbies that create inner thought and mindfulness, things that take your thoughts away from worries. Basically, most hobbies are generative. However, things like gardening, but then getting upset because the plants didn't make it, is not so generative.
Stupid plant.
It depends how good of a gardener you are, I guess.
Right, that's right. And then Matt asks, is reading generative? You know what? I've been hearing a lot of people talk about what helps them when they're going to sleep, if they're having a hard time going to bed. First of all, if you're staying in bed too long, if you can't sleep, you should get up and do something. But then also, one thing that I've been kind of doing every now and then is journaling, just great gratitude journaling. And so it helps me, but it's like starting a new thing. Like I have to make myself do it, and then it becomes a habit kind of thing by the end of the month. But that's one thing. And then I also wanted to talk about like meditation and things like that, like what everyone's thoughts were on that. How about you, Michael? Do
I
you do
love
anything
it.
like that?
I
Meditation?
meditate every night. I've got an app called
Yeah.
Insight Timer,
Hmm.
and I'll just put it on, and I do different types of meditations. Sometimes I'll just try to just go in myself and connect with myself or the universe or whatever it is you want to believe you're connecting with. Sometimes I'll do like a guided meditation. Sometimes I'll do some kind of intentional meditation, trying to visualize something or some other kind of hippie stuff like that.
There's so many cool apps out now. Like
Yeah.
I love Calm, that's my fave. And then Headspace is really good, especially if you're just starting to get into meditation. Headspace. Oh, 10% Happier was a cool one too. Just to
I
help
love
you.
Insight Timer because it's free. And I don't know about the other apps, they might be free too, or free on trial or something, but Insight Timer is just free. You can listen to all sorts of free guided meditations. They have some premium meditations as well. But my favorite part, every time I open up the app, it gives me like an inspirational quote. And sometimes I'll screenshot them too and save them to my inspirational quote folder.
Nice. Well, I'm glad you have one of those.
We did have a question in on Facebook.
Oh, cool. Thanks for checking that.
Rosenberg, my father, asks,
Oh.
does the watch indicate REM sleep periods?
Dr. Cukor?
I think Fitbit does.
So
I think so.
It guesstimates when your REM sleep
Guesstimates,
is.
yeah.
But they're all just approximations unless you're actually getting a legitimate, a kind of full-fledged sleep study. But that is part of the goal, is to there are many different types of sleep disorders, kind of less garden variety sleep disorders, so that, kind of having a full profile of someone's sleep architecture would really give you insight as to kind of what's going on for them. Treatments are often similar, so you just want to get a good night's sleep as best you can. But if it's really not working for you and you've tried, then getting an overnight sleep study is definitely the right way to go.
You heard him, Pop.
I've got a lot of questions here. It's exciting. So Janice has more of a comment. Cognitive behavioral therapy. She's hoping to look into that. Thank you, Janice. Me too. It's really interesting.
Yeah, me too.
And then, oh, Matt, did I not answer your question? I'm sorry. Is reading generative? Patrick, where are you at, Patrick? I don't know. I don't even know how to answer that. Is reading generative?
Patrick did answer it. He said
He
that,
did?
yeah, he said it.
About the
I think
plants?
so.
Okay.
Especially if you share the story in terms of a book club. Even if by
Oh.
yourself, it is probably a top hobby.
Awesome.
Mhm.
Thank you. How come I didn't see that?
It's
Okay.
down a little.
Some things have been like going
Oh,
away
I see
as we
it.
like marked that we answered them or something like that.
I
So,
see it. I see it. Okay. Gotcha. Oh, hey, Dennis. Dennis is on. Hello, Dennis.
Hey, Dennis.
Can I talk a little bit about Dennis?
Yeah.
Dennis is one of the founders of ReMend. So
Hey.
thanks, Dennis. Thanks for being
Hi, Dennis.
here.
I'm new.
Dennis is pretty awesome. So his comment is, I started on Benadryl a month ago and it works great. Was on temazepam for 12 years after transplant, which is a tough drug, he says. Why is it tough, guys? I mean, for 12 years. Wow.
Yeah, it's a long time, Dennis.
Yeah. What do you guys think about temazepam? I don't know if I've taken that
I
before.
don't know anything
Never
about it.
taken it. Never heard of it before today.
Cindy.
Cindy.
Oh, Cindy.
Don't know.
Dr.
Sorry.
I'm not
Okay.
I don't know much about that one, honestly, but I mean, I do know a
Maybe
lot of
Patrick's
people.
got some insight to it.
Yeah.
Oh,
On
yeah, Patrick.
Benadryl, taking that. I mean, there's a lot of people in my circle that take Benadryl quite a bit to get to sleep, and also Tylenol PM. But you have to be careful with that acetaminophen.
Oh, Patrick.
I just consulted with my trusty Google. Temazepam is Restoril, so it's a
Oh.
sedative. It's a benzodiazepine. You know, you need to have a good relationship with your prescriber, someone that you can talk to and trust, and kind of have back and forth with. I think all of these drugs are, have different impacts on everybody, so you just have to share with them. If it's rough for you, you probably want to switch to something else, even if it might not be, kind of what the conventional wisdom is for other people that it helps. If it's for you, if it's not working, try something else.
Right. Patrick does mention that temazepam is a long-acting med in the same class as Valium.
Thanks.
Patrick, we need to have you on here to discuss things. Maybe in
Yes, I would love that. That would be awesome.
Answer all our drug questions.
Patrick's really cool, guys. You guys would like Patrick. Let's see. Jason has a comment. This may have been said already, but sleep studies can be done at home with minimal equipment. I had one and it didn't interrupt me being able to sleep. It led to CPAP and life has been much better. Oh, good. Right on, Jason.
Yeah, so there's different there's different technologies that they use. I mean, the gold standard is still going to the sleep center, and they have other machines that you can take home and that are kind of approximate the sleep study degree of machinery. So there are a lot of places now that will prescribe a CPAP with just using, the kind of the home-based sleep study. So, you don't necessarily have to spend the night at the sleep center if you don't want to.
I think
big CPAP, making more money.
I think something important that Patrick just mentioned is I have seen concerns about high blood pressure being more difficult to treat if you have sleep apnea. FYI. Gotta watch the high blood pressure, kids, with kidney disease.
Get a home cuff and check it.
Yeah. Janice is back. Thank you. She said I did not think about CBTI videos via YouTube or even exercises. So very helpful. Thank you, Dr. Cukor. Let's see.
Yeah, I think, picking up on one of the things that you said before, is developing a nighttime ritual can often be very helpful for people, especially people who are busy and very active. Like we kind of expect to just turn off and like, okay, now I'm gonna get into bed and go to sleep. And I often, encourage people to think about if they had kids, how they put their kids to bed, or if they were kids, how they were put to bed. Usually there's a nighttime ritual. There's, okay, go change for bed, go to the bathroom, go brush your teeth. We're going to read you a story, whatever the kind of, local ritual in your family might have been. And that's really what we need to get back to, so we can teach our body that it's the right time to go to sleep. And I think someone mentioned that, if you're not falling asleep to get out of bed, that is a cardinal principle of cognitive behavioral therapy for insomnia, is that you really try to pair the bed with sleeping. So if you're not sleeping, you got to get out of bed. And also on the flip side, don't do anything in your bed aside from sleep. So, I'm in New York City, space is at a premium. Sometimes that's the only place that you can stretch out. You have a table and you have a bed. So we tell people, do the best you can to kind of stay out of bed as much as you can.
Right.
In our study, we had people that were living in a nursing home and really didn't have anywhere to be. And we would say, okay, so then make your bed and lie on top of it and kind of treat that as your non-bed surface. And then when it's time to go to bed, get under the covers. You really want to kind of get that association, that moment when you get into bed and you feel that relaxation, you're ready for sleep, not to deprive yourself of that good moment.
Well, I have to say that I try to do that, but I am married. And so my wife and I do use the bed for other things sometimes. That's all I'll say.
Great. Good for
I think
you, Michael.
That's permitted.
Good for you.
I do want to say along those lines, we, have some tips. Cutting back on caffeine, alcohol, and tobacco will help with your sleep. Regularity, just like Dr. Cukor was saying, go to bed possibly at the same time and wake up at the same time, weeknights and weekends. And Charmaine, you were mentioning earlier, comfortable surroundings can mean a sounder night's sleep. Keep your room cool. What I found online was saying 65 degrees, which I think is pretty cold, is the optimal temperature for sleep. Expend energy during the day with exercise. Find ways to relax before bedtime. And if you experience insomnia for a week or more, tell your doctor. Adequate rest is an important part of your CKD treatment. And, one thing I wanted to do is, because we're very close to the end here, I wanted all of us to share what works for us. Like what works for you, Charmaine, to get a good night's sleep. What do you do? We kind of talked a little bit about it, but what are some tips you might have?
Yeah, so I, there's a couple of things is that I kind of the ritual, and I've kept my room temperature a little bit cooler, which seems to help. But I also listen to the Honest Guys and their guided meditation, sleep meditation specifically on YouTube. And so I'm just a creature of habit. So I always go to the one that lasts 3 hours actually. And it's just like rain falling, like they talk probably for the first maybe 10 or 15 minutes. And then it's just like rain falling or campfire noises, things like that.
Oh, okay.
But like when I'm laying there, I just really try to focus on like do a scan of my body. I lay on my back just still, and I just like feel my toes, or I'll start from my chest and feel my heart beating, and just do a scan and just to see how I'm feeling and all that. And that seems to helps me to relax, which is great. But it's still, sometimes it helps, sometimes it doesn't, but I just still continue to do it.
Here's a tip from Arlene. She said, I used to drink warm milk to help me sleep. I was raised up on that. It didn't work for me as an adult. Wouldn't work for me because I don't dig milk. There's some other questions coming in, and I know I'm kind of going back and forth, but they're all great. Patrick, does adhering to CKD or ESRD diet lead to insomnia? For example, buildup of waste products from the wrong diet equal insomnia. What do you think about that, Dr. Cukor?
Stands to reason. I don't know that we have data that could actually support that, but I certainly think that people that are more adherent to their diet and kind of fluid requirements, probably just their bodies are optimized a bit better. They're just humming along a little easier, and then falling asleep sleeping will just be that much better.
Shoot, one thing we didn't talk about, restless leg syndrome. That's
another
such a
topic,
huge thing.
another month.
Well, no, come on, let's talk about it if you have a little bit of extra time here, because it's a big thing that people, a lot of people don't realize that other people are going through it too, or maybe they don't even know what it is. It's like their legs are bothering them. They keep moving at night and they probably think, oh my God, maybe I'm going crazy. Dr. Sucre, did you experience that with people in the studies, or just what do you know about restless leg
So
syndrome?
restless leg, is often described as if your legs have a motor of their own. It's like non-conscious movement. You're not moving your legs; they're just moving. It could be kicking, it could be flipping over. Um, it is pretty common, especially for people that have been on dialysis for longer. It becomes more and more common if you're on dialysis. There's kind of metabolic explanation for that, and it can be disabling really at its severe stages. You can't sleep and your bed partner can't sleep. You're flopping around all night and it's exhausting and you just want to go to sleep. So there's medication, it is pretty biological. It's hard to have a psychological treatment for that because you're usually, half asleep when it's happening. There are medications that are believed to be effective. There are clinical trials that are ongoing now that I'm not involved in, but other people are doing, looking at different types of medications for restless leg syndrome. But I think the bottom line is that your nephrologist will not be surprised. You will not be the first person that will come to the nephrologist with this issue. So if you're having a problem, talk to your doctor, and they will have probably a laundry list of potential solutions for you.
Have you heard
Bottom
of
line.
prorenal plus multivitamins, prorenal D multivitamins? Is that something that might be helpful for restless leg syndrome? You don't know.
Maybe.
What does
Someone
Cindy
mentioned
think?
that to me. What do
Yeah,
you think,
I
Cindy?
think it depends what's in the vitamin, what's in the supplement. I mean,
Yeah,
it's typically it's a buildup of waste in the bloodstream that maybe
right.
being somehow causing some sort of syndrome.
Mhm.
I'm not sure really. I'd like to know what's in that supplement, to be honest,
So
just to
it's
see what's in there.
prorenal D multivitamins. So I'll
Hmm.
look into that. But while you're talking, Cindy, what's some of the what's your ritual for a good night's sleep?
Yeah, sleep is a gift, right? It really is. I think as you get older too, you become more in tune with what's important and how to do things better. So for myself, I feel like I try to be mindful of things that I'm thinking about. And if there's things that are worrying me, I try to keep them in my little worry box, like we've talked about before, and keep it closed and put it away. And then, so then I focus on, those things that I'm worrying about, but then I try to figure out and I go back to things that I'm really excited about or things that I'm happy about, things that are refreshing and things that keep me happy and hopeful and positive. And then all of a sudden you're not feeling so, I guess, apprehensive to fall asleep. But I also like to be in tune with my body and movement at night, and I have a good routine. I think like most everybody else, washing my face, brushing my teeth, making, doing all these
Right.
things. And then, I like to lay down with some good reading, some good literature, or watch a good Netflix series. And so,
But
just
not in bed.
yeah.
Not in
Sometimes
bed.
I cheat.
I do too. I do too.
Yeah.
I want to ask everyone this, but I don't want to keep everyone too
Yeah.
long. What do you guys hope that people take away from today's conversation? And I'm sorry, there are a lot of comments, but I'm not able to get to all of them. But we're closing in on the time here. So, Dr. Sucre, what are some of the things that you'd like people to take away from our discussion today?
I guess for me, sleep is really important, and it's often one of the few pleasures that you can indulge, as you're feeling worse and worse as we're getting older and older. So it's really important to kind of be able to prioritize getting a good night's sleep. If you're unable to sleep, that should be a priority for you to work on and to identify ways to get you to sleep better, whether that's through pharmacological help by speaking to your physician or non-pharmacological YouTube searching or, different behaviors or habits, or seeing a cognitive behavioral therapist who might be able to help guide you through it. But I think not accepting that you just are a bad sleeper now because you have more health difficulties is probably what I would encourage everyone to leave tonight with.
Thank you, Dr. Cukor. Michael, what are your thoughts?
I think I'm taking away, number one, talk to your doctor. Number two, I like what Dr. Daniel Cukor said. Don't accept that you're just a bad sleeper now. I think our thoughts are important, and what we think kind of drives how we act. And if you think you're a bad sleeper, you're going to be a bad sleeper. And if you're like tossing and turning, you're like, oh man, it's 4:30 a.m. and I have to wake up at 6:30 a.m. That's just going to make you stress out more. So
Right.
like Cindy was talking about, her husband had the watch. He kept checking the watch. Oh, am I getting good sleep? Am I getting enough sleep? That's going to stress you out more. And I think that is such an important message, to mind your thoughts.
Right. Mind your thoughts. Thank you, Charmaine.
I think that, it's been important to know that we're not alone in all that we're going through in our kidney journey. And I think that it's important to, as Michael said, to talk to your doctor. As Dr. Daniel said, to, that you're not a bad sleeper. I love that too. It's just a part of where we are right now, in this journey. Sometimes it's good, sometimes it's not good, but I just think that learning how to quiet our minds is the first step. I think that we're so busy because it's a whole nother conversation, but we're just so busy.
Yeah. Yeah.
For various reasons. And I think we need to stop being so busy in our minds. And I think that that's really what I took away from it. I hope others will too.
I do want to say one comment that Janice mentions here in the chat. Hope. I love all the sharing of things to try and to never give up. Being our best cheerleader can be so very helpful. Love this session. Thank you all so much. And thank you, Janice. Thank you.
Love
That's
that.
awesome.
I was hoping I could read this one thing real quick. This is something that I had a stroke, and so I was seeing a psychiatrist for a little while, psychologist, and then they gave me this thing. It's a saying to say before you go to sleep. Bedtime is vacation time. Mine don't bring up problems when I'm trying to get to sleep. I'll deal with them in the daytime. And then there's this whole other list of things, but I just love that. Bedtime is vacation time. Go on vacation.
Bedtime is
Love
vacation
that.
time. I'm down with that. Thank you. Thank you all so much for sharing and for being here. And since next month is are you guys hearing this
Yes.
music that I got going on?
No, not music. Oh, there it is. Yeah, I can hear it now.
Okay, cool. Next month it's Thanksgiving. Can you believe that? It's a time to be thankful. So the topic is going to be kidney parent exchange. So that's a big topic for folks. Also, Thursday, November 17th. And I want to thank everyone for being here. Thank you so much for watching. Please reach out to ReMend.org for more information about ReMend if you're interested in speaking with a mentor or becoming a mentor. We would love to have you. And I don't know if you have any other questions, and I'm sorry if we weren't able to answer all of your questions, but all of us at ReMend and all of our wonderful partners and friends here want you to know that you're not alone. Thank you so much for being here. You have resources and people who want to listen and who care. So thank you so much for watching, everyone, and just peace out.
Thank you guys. Thanks, everyone.
Thank you.
Bye, everybody.
Thank you. Good night.
Night.
Sleep good.
Go on vacation.
Going on vacation now.
Yeah. Night night.